I'm Professor Graham Roberts. I'm a paediatrician specialising in allergy and respiratory medicine from the University of Southampton and the David Hyde Asthma and Allergy Centre in the Isle of Wight. I'm very pleased to be able to talk about the work that the EAACI Adolescent and Young Adult Task Force has been doing over the last few years. The task force is a multidisciplinary team of allergists, paediatricians, ENT and dermatological specialists, primary care physicians, nurses, psychologists and patient representatives from across Europe. The task force has been focusing on helping healthcare professionals to better manage adolescents and young adults with allergy and asthma. The task force has been funded by the European Academy of Allergy and Clinical Immunology. I'd first like to tell you a bit about what I'm going to cover in this short video. I'm going to give you an overview of the Adolescent and Young Adult Task Force's activities. My task force colleagues have prepared some other videos which give you more detail about some of the individual parts of the work we've undertaken. I'd first like to explain why we decided to focus on this age group. Then I would like to take you through how we developed the EAACI Adolescent and Young Adult Guideline. And then I'm going to just explain how we think you might want to use the guideline. So first of all, why focus on adolescents and young adults? About 1 in 7 of them have asthma, about 1 in 50 have food allergy, and of course some have both. Now, it is usually people think of this age group as quite healthy, and actually they're not. And if you look in the fatal anaphylactic series or the fatal asthma series, you find that this age group is overrepresented, and they suffer actually quite a lot of mortality and morbidity. I don't need to tell you that they can be challenging patients, but there's actually good reasons for these. The developmental tasks of adolescents really conflict with the needs of someone who's got a long-term health condition. Adolescents want to be independent, they want to be autonomous, just like their peers, and that's really quite difficult if you've got asthma or food allergy. Additionally, they have to learn the huge range of skills that's required if you're going to start to actually take on your management of your condition yourself. They have to become an independent, expert adult patients. And for this, they need training. And we call this process transition. It's really key to actually successfully managing this age group. Unfortunately, adolescents are overlooked in terms of service provision. Even more problematically, many health professionals are actually poorly trained to support this group, and that's why we as a task force decided to focus on transition and explaining why it's actually an important area. So we approached this project as a series of interlinked steps with one building on the previous ones. We started off with a survey of the EAACI and National Allergy Society members in 2019 to really understand how we currently deal with this age group. It was really helpful in actually helping direct how we approach the guideline. In terms of the guideline, we underpinned it with 2 systematic reviews, one looking at the challenges associated with adolescence and young adulthood, and the second looking at potential interventions for helping to improve the outcomes for this group with respect to their allergy and asthma. These are both published in Allergy. We used the agreed to approach to develop the adolescent guideline. This emphasises the need to involve all stakeholders to systematically review the evidence and develop recommendations that are based on this evidence, plus also practical considerations. So the draft guidelines were reviewed by the EAACI family early in 2020. We got a lot of really good feedback, and that helped us to finalise the guideline. We also translated the recommendations into lay recommendations, and then we invited adolescents and young adults with allergy and asthma and their parents to feedback on these recommendations. Again, we got a lot of really helpful comments, in fact over 1,000, and they again helped us to refine, improve and finalise the guideline. So the EAACI Adolescent and Young Adult Guideline is now finalised and has been submitted to Allergy for publication. We think the guidelines should be helpful for a wide range of healthcare professionals involved in looking after adolescents and young adults with allergy and asthma. So if you're a paediatrician or an allergy specialist working in a hospital or community setting, you'll need to support your adolescent patients while they negotiate the challenges of the adolescent years to become independent expert adult patients. And the guideline is designed to actually support you doing that. It's also helpful for nurses, dietitians and other healthcare professionals. It's really important that everybody takes a consistent approach to help these adolescent patients successfully transition to independent, competent, expert adult patients. The task force is now developing what we call a teen toolkit. And the idea of this is to provide some practical help and assistance and advice to assist people in implementing these recommendations into everyday clinical practice. So for further information about the guideline, you can look at the other videos in the series which summarize the different elements. If you want to have a look at the underpinning evidence, I direct you towards the 2 systematic reviews in Allergy. You can find the Healthcare Professionals Survey in Clinical Translation of Allergy. And you can also look at the lay summary of the guidelines, which is on the EAACI website. We're really keen to hear feedback about the guideline and would welcome comments and questions. So on behalf of the entire task force, I'd like to thank you for your interest in our project, and I hope you find the guideline to be helpful in your clinical practice.